Hello, I'm Dr. Julie Schell from Bow Bottom Veterinary Hospital, and today I'm going to demonstrate how I do a physical examination on a dog. And this is our beautiful little Jetta, and we're going to start by looking at her. It's very important that we do a full physical because dogs, they actually, of course, can't talk, and it's very difficult to determine if they're ill unless you do a really good observational exam. So I like to start with the body and pet them. We've actually already applied some peace and calming oils to our patient. She really likes to feel as calm as possible, and the aromatherapy works really well. And I also have some little treats, some healthy liver treats, as well as some hypoallergenic cookies for my patients, and they really enjoy that. So I first just get introducing myself to the pet and give them a good patting. It's always great to have the owner with the pet to help relax them. And so I'm looking at her ears now. A lot of dogs love their ears to be rubbed, and so I just look on the inside of the ear. With her, I'm also going to look in the depth of the ear. There's a little bit of dirt on the outside of the ear, so what I'll often do is just take a little tissue and clean off a little bit of it. And then it allows me to look in the ear nicely. So we're taking a thermoscope and turn it into an otoscope. Look into the depths of her ear chamber. So it's good if I ask the owner to massage the right ear while I look in the left, and vice versa. Good girl, Jetta. Good, and it's nice and squeaky clean down there. I can see the eardrum. It's very deep. The ear's an L-shaped canal, so we have to look really hard. And let's switcheroo, and you can massage the left ear while I look in the right. Looks really good. There's not much hair. There's not much debris. If I did find any suspicions of infection and debris, I would definitely take a swab right now and look at it under the microscope. Good girl, Jetta. Now, I like to look at her teeth, and that's an important little aspect of a dog. With her, she has an underbite, so you can actually see where the teeth are misplaced. She's a very young dog, and so we don't see any massive infections. I do see little bits of mobility here, and so when I'm touching the teeth gently, it's mobile. And see how she doesn't really like me touching them because she's licking her face, and so often that's a sign of pain. So we're going to talk with her owner about doing a dental cleaning, doing some x-rays on these lower teeth, and she'll definitely need some extractions whenever I see mobility of the teeth that bad. That's important. And this is a dog that's eating well, chewing well, crunching her food, yet she actually has pretty darn severe dental disease to have mobile teeth. So we're going to fix her up. And then the back part I'm looking at too, there's some gingivitis, and you can see some yellow plaque forming on her. And all of this is fixable. It's a treatable disease. Sometimes the treatment is extraction, or if there's a broken tooth, I do a root canal and try to save that tooth as best I can. And then also there's some good home care and some good prevention techniques we use. Thank you very much. Good girl. We're going to help you out. This is important. The next up, since she's such a good dog, is I'm going to look in the very back of her eyes. It's called the fundus, and it's basically to check for the nerves and blood vessels of the eye. So what I do is I turn the lights out. So we're going to quickly turn the lights out and look in her eye. And I can see the glow, and there's beautiful optic disc, which is the nerve of the eye. It goes right into the brain. It's the closest I can visualize the brain of the dog by looking at optic nerve number 2, which is cranial nerve number 2, the optic nerve. And all the blood vessels look good. You can see all the cones and rods. I call the shiny portions of the eye. It looks really nice. And same thing, I'm looking at the external structures like the third eyelid. And I notice her response to light when I'm shining it in there. There's a nice, beautiful constriction of the pupil, so the pupillary light reflex is good. In her, it's kind of neat. I actually see a iris defect, so there's a little bit of a decreased pigmentation and a decreased iris, so she has a bit bigger of a pupil than most dogs. It's probably a congenital defect. We actually have board-certified veterinary ophthalmologists, like veterinarians that are only looking at eyes, so we can always refer our patients to a board-certified person to get more information about that. Very interesting. So I'll be marking everything that I see in my patients. I mark them down as my medical records, and that's good because I can refer back to it. The owners can refer back to it if I ever have to send the medical records to another vet. There's always good notes in there. That's very important. Next, I'm feeling the rest of her head, so I'm kind of palpating her lymph nodes. There's some nice lymph nodes under the skin. We can actually feel our own lymph nodes when we are ill. It hurts when we have lymph node inflammation, so we always feel for that in our patients. And same thing, there's lymph nodes all over the body. And that's a very important indicator of whether or not there's inflammation or pain going on in the body, or even I can detect if there's early cancer in the dog by feeling for lymph nodes, feeling for hot regions and areas that look sore. The nails are beautifully done, so the owner's been doing a great job of trimming those claws. That's very important. I'm feeling for the body condition, and in some of my other videos we talk about body condition scoring, and definitely Jetta is a bit plump, so we're going to talk about getting her on a proper diet, and it's important to do some blood work first to make sure the organs are healthy enough before we change diet and to figure out exactly what the best nutrition form is for Jetta. And we like to do a little bit of an exam of the limbs. So I like to kind of, I hear a luxated patella in the right knee. So I'm feeling like the knees and all of the joints in the body. And so that's something that will improve. Her mobility definitely will improve when we do weight loss. And look at that beautiful, nice flexion and extension of her hip. Her hip can extend really well and it can flex really well. The knees, on the other hand, have a little bit of a popping. So that's something that we can definitely treat. I do a lot of chiropractic and acupuncture, and that really helps improve mobility and strength of the muscles. Good girl, and her left one has it too, a little bit of popping. I also, when I'm down here, reward her because I'm touching her privates and she doesn't like me doing that. And so I like to look at her bum, and there's little anal glands at the left and right side. Hers are tiny. I don't even feel much secretions on there at all. I'm doing an external exam on there, so it feels good, and she hasn't been scooting or rubbing her bum. So that's a good sign that her anal glands are comfortable. I also like to look at her undercarriage, so I get the owners to kind of lift her up like I call a teddy bear hole. And so we're looking at her beautiful belly. This is normal to have like a little bit of thin skin on her belly. I'm feeling for lumps, I'm feeling for tumors, and the whole shebang. Good girl. And then we go and give her another reward. She's on a diet, so I don't like to give too much, but we'll definitely get her on low-calorie treats, like vegetables are good. I'm listening to her heart. It sounds very clear. There's various areas where I listen to, as well as the lungs. And at the same time, I listen to the rate of the heart. I count the rate and determine how many beats per minute, and whether or not the heart is at an even pace, nice rhythm. And as she breathes in, you can hear her lungs sound really normal. Good girl. Rubbing in between the eyes also calms the dog. It's the yin tong spot. It's a great acupressure spot and acupuncture spot, and behind the ears, dogs love it. It helps relax them. Good girl. That sounds really good. I also like to feel the pulses. It's the medial aspect of the femoral artery there, the medial aspect of the hind leg. I can feel the femoral artery pulse, and it feels really good. It's in alignment with the heartbeats and everything, so she's healthy in her systemic area. I also at this time like to recheck her mouth and do a little bit of a capillary reflex time, so capillary refill time, so I kind of push my finger in there. It turns white and then blanches pink really well. Good girl, what a good girl. Is a little different kind of reward for her. She's very nice with her food loving. So then I always like to take a body temperature of a dog if they accept it, and usually they don't like it as much, so I try to reward them as much as I can. And it's great that the owners are here to give some nice pettings, and looking for the body temperature elevations or too low of body temperature helps me determine if there is any other hidden underlying diseases that we can look for. And hers is normal. 37.5 to 39.5 is normal in cats and dogs, so that's really good. Good girl. And then I just do like a palpation and feel her belly if there's any pain or any. Sometimes you can feel lumps in the inside of the belly if you feel really hard. Sometimes in really thin animals you can feel their bladder, their kidneys, their liver, their spleen. It's quite amazing what you can feel. You let your hands kind of guide you. You let your hands see things that your eyes cannot. To well round the physical exam, I also like to do some blood work and some urine analysis. So we collect it here in our facility, and we can run the lab results and figure out exactly what the internal organs are doing. So it's a nice complete physical exam, just like what is done as a yearly physical exam in a human. For a young dog, I like to examine them at least once a year, and same thing with cats. And for a senior citizen cat or dog, I like to examine them twice a year because they age a lot faster when they're in their senior years. So this is basically a really quick full physical exam that we've done on Jetta, and she was a really good girl. So definitely if your pet is due for physical exam, if you're not sure when it has last had its physical exam, definitely bring him or her to your veterinarian right away and give them a phone call and sign them up. Or you can definitely check us out online at www.bowbottomvet.com or give us a call at 403-278-1984. Thank you very much. Good girl.